Good afternoon. Well, I think these are tragic events, and I think the COVID-19 pandemic has created exigencies which were probably not foreseen in a number of these institutions. Most hospitals, in fact, all of them of capacity, will have oxygen reticulation with the measures in place to mitigate any danger emerging from, sparks hitting this highly flammable gas. And generally, when in normal times, hospital use of oxygen is pretty well regulated. I believe in these moments, especially in crises areas such as in India, where oxygen supply has to be increased dramatically, the existing reticulation is often added onto, by new pipes, new machines, new cylinders, etc. And it's likely that the problem actually lay there, that where the installation may well have been faulty. But again, it's important to understand that the increased use of oxygen in these facilities during especially surges of COVID, where oxygen is the mainstay of treatment, the risk of an outbreak is much higher. So I think the first thing that all authorities have to do in hospitals is revisit and review their current fire regulations. In hospitals in particular, because of the immobility of patients, the evacuation of patients, for example, is a difficult affair at the best of times. For obvious reasons, patients are immobile, there are monitors, drips, etc., and it's difficult to manage them. I think the additional capacity for oxygen reticulation is firstly an area that must be properly managed. It must be done through, certified oxygen reticulation engineers. For example, in South Africa, a couple of months ago, there was a problem in a COVID ward where oxygen was being used. And there was a problem in terms of the reticulation pressures were dropping. They brought a team in that had absolutely no idea about hospital use of oxygen, and they simply turned off the oxygen supply, resulting in the deaths of some patients before they could, before the staff figured out what was going on. So these kinds of things are going to be breakthrough events. What has to happen is urgent, detailed review of fire management in the context of increased oxygen use. And I think every hospital will have regulations, and I think it behoves the authorities to revisit those urgently, especially now. The people managing the process of increasing reticulation, bringing in tanks, etc., have to be qualified to do that. We might take it for granted that oxygen is just a gas, you stick a tank in and presto, you've got oxygen supply. It's not as simple as that. So qualified reticulation engineers have to be used. That's the first thing. Second, authorities have to be aware that a fire may break out at any given moment. It may not be in the reticulation system. It may be at the outflow areas, in wards, where a high oxygen content in the atmosphere will be amenable to a spark lighting things up when in ordinary circumstances it wouldn't. So again, fire marshals, fire monitors, and proper regulatory approaches would be your best bet in minimizing these events. Now, it's difficult at times, and one understands when there's a pressure and a huge influx of patients and you just don't have time to do things. Mistakes are made. And unfortunately, we have the kind of accidents we have had. But, there's really no getting around the fact that increased diligence, due diligence on oxygen reticulation, oxygen management has to become a mainstay. And this is not going to be only for now. We are going to have further waves and resurgences all over the place. So there's really no excuse for not reviewing the urgent fire management regulations in all facilities right now.